Now, Kathy, you've been here at Premier Therapy, receiving treatment from our facilities and our people here. And I just want to talk with you a little bit today about your experience with physical therapy and really about your ankle and what you expected that might occur from physical therapy. And if you can just kind of tell us your experience from previous times that brought you back here to Premier Therapy, and just let us know kind of some information about that, if you would.
Well, last November I had my hip replacement, and you guys were so good to me, your staff and the owners, and your staff, as I previously said, and I just knew that this was the place I wanted to come when I had my ankle surgery. And even before I had my ankle surgery, I told my doctor that this is the place I wanted to come for my rehab. I didn't know what to expect, but I just knew whatever I got was going to be the best I could get because you guys really worked with me with my hip. And when I first came here, my ankle was immobile. I had my ankle replaced.
Yes. Could you tell us what you had done? Because it's such a rare surgery. You know, there's a lot of hip replacement, knee replacements, and some shoulder replacement. But an ankle replacement is very rare, and very few orthopedic surgeons do that. And you went to a specialist actually out of town that specializes in that. And I'm sure that he is used to physical therapy and what results occur with typical physical therapy. And so maybe you can tell us about, you know, where you went out of town, what he did, and then what you experienced in physical therapy and the functional results, and then what his response to you was concerning that.
Well, I wish I had my x-ray here with me. That would really show the people what I'm talking about. But the ankle replacement, where my ankle was worn out, my ankle was worn out from compensating my weight off of my bad hip.
Right.
But when I went to the doctor on the 13th, and he wanted me to have 9 visits with physical therapy before I went.
Right.
And my 9 visits, I did not know, and he did not know what to expect from my therapy here at Premier.
Right.
But I was amazed at what your physical therapists and your PTAs that worked with me did with me. And my doctor, when I went back to the therapist on the when I went to my doctor back to the 13th of this month, he was just utterly amazed. He was so pleased with what they did with me.
Great.
That my range of motion was just outstanding, where I could move my ankle in comparison to what he thought it would be.
So he was kind of ahead of the curve for the time status post-surgery that typically he sees with these ankles, and this is what he routinely does. This is his specialty.
Yes, the clinic that I go to in Westerville, Ohio, Dr. Philbin is my doctor's name. You have down here. You've only had one other patient that had ankle replacement, and that's how I found out about Dr. Philbin up in Westerville.
Right.
And as I said, he was so pleased. He mentioned it 3 different times how pleased he was about my range of motion and what you all have done with me. And I also told him that being down here at your place, Premier Therapy, on 13th Street in Blackburn, that not only have I been pleased with what you've done with me, that I love the staff here. I love how they treat me. They don't treat me like a number.
Right.
They treat me as a person, an individual. When they're with me, they give me the individual attention that I need.
Right.
That they work with me directly, and they call me. They give me the respect, and they call me Miss Cathy, and I just love it.
Correct.
I just love it, and even yourself. And the other gentleman,
Dave Apps, yes.
Dave, he even calls me Miss Cathy, and it's like, when you walk into this place, you're not just walking off the street. You're walking into a place that you're a person.
Right.
And they, like I said, they have the modern techniques and the machinery, the things that you need to have the recovery that you expect.
Get the functional use of that ankle.
Yes, yes, and I just love it.
Well, you know, several things,
Excuse me.
Kathy, that we try and do. We try and, as you say, treat people like we want to be treated.
Yes.
And
you do.
number two, we want to have a product, and that product is a patient and get back to life, and want to be the go-to place for people such as yourself. So, you know, our facility not only is friendly, as you said, but we want our therapists to have the technical knowledge and the hands-on treatment that's going to restore that function so you can get back into life. And really, that's what it's all about. And
Yes.
From the beginning to the end. And so I'm glad that your physician was pleased. And usually your orthopedic surgeons, when they do the surgery, they're counting on great outcomes, great hands-on treatment that restore movement, that restore strength so that the patient can get back into life and weight bear and do the functional things they have. So really, it's most orthopedic surgeons says they do the surgery, but just as important is that rehab so that the patient can blend the two together and then get back and be a functional individual in society. So I'm glad it sounds like you experienced that here.
I have. I definitely have. When I came out of surgery, I was 100% non-weight bearing.
Mm-hmm.
I can actually walk. I was in a wheelchair, then I had a walker, and as you can see now, I am on my cane.
Mm-hmm.
And I'm just tickled to death. The next step is walking without my cane.
Awesome.
And I'm sure that before I leave here with my therapy appointments, that I will be off my cane. And that is my main goal. And I'm going to run.
Well, Kathy, it's always a pleasure. And, you know, when patients come in, a lot of times they don't know what to expect.
Oh, you can expect the best.
And well, thank you. And so that really makes our day. That's why we get up out of bed and come to work. That's our mission. Our mission is really to be the go-to people. So when people in our communities, wherever we're at, and therapy is mentioned by their physicians, that the community people will recognize that there's a household name that says, no, when you got to go to therapy, doctor, I want to go to Premier. And it's people like you in our communities that allow us to stay in business and have functional outcomes, and that's what it's all about. So thank you.
That's right. Thank you.